What is an autoimmune condition? An autoimmune condition simply is when your immune system is mistakenly and abnormally attacking your own body tissue. Now, it could be your thyroid being attacked and causing you to feel sluggish, having weight loss problems, depression, and all those sorts of low thyroid symptoms. It could be your pancreas under attack. You could be developing diabetes right now because your immune system is attacking your pancreas. Now, the immune system could be attacking the cartilage in your joints, as in rheumatoid arthritis. Now, what can the immune system attack? The immune system can attack anything in your body. It can attack your thyroid, pancreas, liver, intestinal lining, nerves, brain, heart valves, cartilage in your joints. I mean, you name it. It can attack anything. That is an autoimmune attack, an autoimmune condition. Now, the autoimmune reaction creates inflammation of cells and organs, which leads to vague and intermittent symptoms that waxes and wanes. Now, many times you don't feel well. You have chronic fatigue, joint pain, muscle pain, headaches. You may have trouble falling asleep or staying asleep. You may have been diagnosed with fibromyalgia. Now, you may have numbness, tingling, or other abnormal sensations and been diagnosed with neuropathy. You may have digestive issues like gas, bloating, burping, or indigestion, reflux, constipation, diarrhea. You may have been diagnosed with irritable bowel syndrome. You may have trouble losing weight and have sweet cravings. You may have dry skin, hair loss, poor nails, skin rashes, or eczema. You may have hormonal issues and lack libido. You may have brain fog or inability to focus and concentrate. You may have neuropsychiatric symptoms like anxiety, depression, ADHD. You might have been even told that this is all in your head and that you think you're going crazy. Now, this autoimmune reaction or inflammation can go on for many, many years without your doctor ever picking it up. You see, I know this because 90% Office Autoimmune Solutions Workshop in my DVD, I go into detail of how different foods may trigger autoimmune reactions and what part of the immune system actually goes awry. Now, in my office, the way we look at autoimmune conditions is from a functional perspective. So it's not just, is my joint or my thyroid or my organs inflamed? Rather, it is, why is my body inflamed in the first place? What are the triggers? Can we remove them so that you can start to have more good days than bad days and start to turn your health around? Can we teach you to avoid the triggers so that you can get back control and power over your own body and your condition and start to restore hope? There's a lot of steps that has to happen to make that work, and I've spent a lot of time and resources to get the training and knowledge of what it takes to make it work. I believe that is why my neurometabolic integration program has been so successful for those patients that have not responded to conventional medical treatment. And the types of tests and different causes of autoimmune conditions are discussed in my live in-office autoimmune workshop and in my DVD. Now, in our live workshop, we also cover the concept of expand-style autoimmune. Now, you get the full scoop when you come to the workshop, but here's a tidbit. If your immune system is already attacking one tissue, it's actively looking for another tissue to attack. Okay? So you can feel better when you're in remission, but the problem is you still have a ticking time bomb. Now, that's how autoimmune diseases work. It never just stops with one tissue. You have this progression of the disease, unless